For our psychology and film projects, we chose the movie Shutter Island. These are our group members. We have Carla Huffman, Felicity Riebel, Payton Landry, and Catherine Casserly. To start off with a description of our main character, Andrew Latis, he was a schizophrenic patient at Ashcliff Hospital, a government-run institute for the criminally insane, which was located on Shutter Island near Boston. He was a United States soldier who fought in World War II, was captured, and was held in a concentration camp, so obviously suffering some major traumas from the war. He suffered a breakdown after killing his depressed wife who had drowned their children. He was then committed to Ashcliff and was placed in Ward C, where the most dangerous patients are kept. Andrew created the identity Teddy Daniels in order to erase his memories and to make himself a hero in his own mind. He had been continuously replaying this delusion for 2 years, and doctors would play into it as a form of therapy. Our diagnosis for Andrew was schizophrenia. Schizophrenia is a mental disorder in which people interpret reality abnormally. The culture context. The film is set in the 1950s at an institute for the criminally insane. At first, Andrew seems like a fully functional person, but as the movie continues and his symptoms begin, from our viewpoint about his mental state changes. We are able to compare him to other patients in the hospital with schizophrenia and see how similar their symptoms are. Andrew becomes paranoid and erratic, just as some of the other patients who have been diagnosed with schizophrenia do. Some evidence that we pulled, we have symptom 1, which is delusions. The DSM-5 explains that delusions are fixed beliefs that are not amenable to change in light of conflicting evidence, which is exactly what Andrew Latis had been experiencing and unable to accept. Andrew's major delusion in the movie, which had lasted 2 years, was that he was not actually Andrew Latis, but Edward Teddy Daniels, who was a court martial and allowed him to put himself in a more positive light. Our second piece of evidence was his second symptom of hallucinations. The DSM-5 describes hallucinations as perception-like experiences that are vivid and clear. In the movie, Andrew Latis experienced multiple hallucinations of his wife and daughter and a made-up patient named Rachel Solando. Andrew hallucinates that the missing Rachel Solando camped out in a cave after climbing a cliff down the island, and then, as you can see in this picture, there was a car explosion, and he had multiple similar hallucinations throughout the film about his deceased wife and first daughter. Our treatment recommended for Andrew Latis, we believe that a combination of drug therapy and cognitive behavior therapy, or CBT, would be the most effective for his case of schizophrenia. In drug therapy, we would recommend antipsychotic drugs to reduce Andrew's positive symptoms, especially the hallucinations and delusions previously mentioned. We would then pair the drug therapy with CBT in order to get to the traumatic root of Andrew's disorder. For this, we recommended exposure therapy in order to try and reveal to Andrew Latis his true past and try and break down the delusion and get to the root of the trauma, which was his time in the war and then also the event of his wife killing his children. Broader perspectives. The movie Shutter Island portrayed a slightly overdramatized version of schizophrenia, but the basics of the disorder were properly shown in the movie. In real life, many people suffer from the same level of symptoms, such as Andrew's tremors. One of the differences was that the doctors and the people at the hospital played into Andrew's hallucinations, which would not normally happen to that extent, but other than that instance, the movie portrayed the disorder quite accurately. And when we mentioned here that the hospital was playing into the hallucinations, that was a form of therapy that was used for Andrew to try and expose a part of his past. And that's all for our presentation. Thank you very much for listening.